Hello, this is Colin Rourke from the Kansas Department for Aging and Disability Services. For the purposes of the final rule, I am the director for the heightened scrutiny process. The following slides will provide some next steps on the road to compliance for the final rule in Kansas. This presentation will provide guidance on a review of what heightened scrutiny is, the heightened scrutiny process and expectations, for all categories 1, 2, and category 3. We'll go over the remediation tab and the color legend that is associated with that, as well as some heightened scrutiny technical supports and resources. For some additional information, we have a team of 6 KDADS staff on the heightened scrutiny team. The goal of this presentation is to help clear up the process and provide more information about the heightened scrutiny team and the processes that are designed to assist all willing and able providers to come into compliance with final rule requirements. Some initial heightened scrutiny guidance. Heightened scrutiny is triggered based off the answers to questions on the provider's self-assessment and evidence submitted or not submitted on the Community Connections website. The total number of heightened scrutiny settings will be determined once the desk review process is fully complete. At this time, due to limited capacity at KDADS, September 1st of 2020 is the projected date for completion of all setting desk reviews. What is heightened scrutiny? A presumption of institutional characteristics in home and community-based settings. As a result, Kansas and the Centers for Medicare and Medicaid Services, known as CMS, must take a closer look at the setting to determine whether or not institutional-like characteristics are occurring, and that persons are not being isolated from the broader community or from individuals not receiving HCBS. A few examples of institutional-like characteristics would be affiliation with an institution, large numbers of persons being served, everyone eats at the same time, medications are given at the same time, no choice of services off-site, none or very limited access to the greater community for persons served. The following are the CMS Identified Heightened Scrutiny settings. There are 3 categories. Category 1 are settings that are located in a building that is also a publicly or privately operated facility that provides inpatient institutional treatment. Category 2 settings are in a building located on the grounds of or immediately adjacent to a public institution. Category 3 are any other settings that have the effect of isolating individuals receiving Medicaid home and community-based services from the broader community of individuals not receiving Medicaid HCBS. Some of the common MythBusters that we've received from some frequently asked questions include: does heightened scrutiny mean the provider and/or setting is non-compliant? That is false. KDADS believes providers and/or settings in heightened scrutiny either already overcome the presumption or can make necessary updates to overcome the presumption that led to the heightened scrutiny designation and continue providing HCBS for Kansans. A heightened scrutiny designation means there are either characteristics of an institutional setting or the setting has the effect of isolating individuals from the general public. The state is required to take a closer look to ensure services are actually home and community based and present that information to CMS to make the final determination. Another one is heightened scrutiny and remediation. I received 2 emails. There must be a mistake. This is also false. A setting can trigger both remediation and a heightened scrutiny designation. Both require further action to become fully compliant with the final settings rules and will be tracked until they are implemented. Persons served have to move. False. Again, KDADS believes that all providers and settings can become compliant with final rule requirements through remediation if a collaborative relationship is established. Another common thread is a provider has to move the building, tear down walls, put up walls, build a new facility, or take other major steps to address heightened scrutiny. This is also false, as most steps to remediate a setting surround policy, procedures, practices, and person-centered service plans. And then finally, the most recent one is heightened scrutiny reviews must be submitted to CMS by July 1st of 2020. This is also false. It was the original goal and provided by CMS as guidance. Due to the current pandemic, we are working with CMS to determine updated timelines and guidance to complete the heightened scrutiny process. But we would like to reiterate that the heightened scrutiny process is just beginning, and we will keep everyone updated with updated timelines. So this slide is a quick bullet point of the heightened scrutiny review process. It starts with the provider self-assessment being submitted. Then it moves to validation and desk review. After that, the setting is notified of the heightened scrutiny status and remediation requirements as applicable. After that, a heightened scrutiny site visit or its equivalent, if required, is completed. Then submission of evidence to remediate by the provider is submitted to the Community Connections website and tracked by KDADS and the heightened scrutiny team to ensure implementation. Then the validation and desk review process also will begin again. And then finally, the heightened scrutiny determination, ongoing monitoring or transition. As stated in previous slides, we would like to not have any transitions and have all those that are willing and able to comply with final settings requirements to continue providing HCBS services. So assessing for heightened scrutiny, after the completion of the provider self-assessment in Kansas, heightened scrutiny is triggered by the provider self-assessment and evidence submitted or not submitted to KDADS. KDADS must review each setting assessment and work with the provider to determine if a setting can overcome heightened scrutiny. Some settings will require an on-site visit or virtual equivalent by KDADS. All Category 1 and Category 2 settings will require an on-site visit or equivalent. Category 3 will only require a site visit if deemed necessary due to evidence, lack of evidence, or public response. Otherwise, Category 3 settings can make necessary remediations that will be presented to CMS if the state determines it does or can overcome heightened scrutiny presumptions. Assessing heightened scrutiny continued. An on-site or equivalent heightened scrutiny assessment tool will be completed by KDADS for all Category 1 and 2 settings. Settings in which the state believes already overcome or have established plans to overcome the heightened scrutiny presumptions will have a summary packet created to present to CMS. Heightened scrutiny packets submitted to CMS can include plans. Those plans will be monitored and must be implemented prior to the 3/17/2022 date, or the setting will not be able to serve HCBS participants and must transition those individuals. KDADS will publish heightened scrutiny packets for all 3 categories for public comment. After the public comment, a sample of packets for all 3 categories will be reviewed by CMS. CMS will have the final determination on if the state's processes are sufficient to identify whether a setting can or cannot overcome heightened scrutiny and make the final determination. Some additional information on assessing heightened scrutiny Category 3 settings. Kansas and CMS intend to take the following factors into account in determining whether a setting has the effect of isolating individuals. Due to the design or model of service provision in the setting, individuals have limited, if any, opportunities for interaction in and with the broader community, including with individuals not receiving Medicaid-funded HCBS. The setting restricts an individual's choice to receive services or to engage in activities outside of the setting, or the setting is located separate and apart from the broader community without facilitating beneficiary opportunity to access the broader community and participate in community services consistent with an individual's person-centered plan. So some of the activities that you can expect for the heightened scrutiny assessment by KDADS: the provider will be contacted by a member of the heightened scrutiny team to schedule a heightened scrutiny assessment for Category 1 and Category 2 settings. The heightened scrutiny tool or assessment will be utilized to assess if a setting can or cannot overcome heightened scrutiny. Interviews will occur with person served, staff, and the executive director or program manager of the setting. There will be an observation section, for example, where we'll want to see living spaces, amenities, policies and procedures, activity calendars, person-centered plans, etc. With the current circumstances, we would likely have you submitting pictures of living spaces, amenities, and those other items, as well as potentially participating in a Zoom or virtual equivalent to get a better idea of this setting where individuals are residing. The heightened scrutiny assessment is an opportunity for the provider to show that the setting is home and community-based. Home and community-based settings should be the least restrictive as possible. Any restrictions or modifications to final rule requirements should be person-centered for specific individuals and documented appropriately in person-centered plans and behavior support plans. In response to COVID-19, the safety and well-being of everyone is important as we all respond to social distancing guidance due to COVID-19. At this time, KDADS plans to complete needed in-person site visits when it is deemed safe by local health departments and KDADS leadership. The heightened scrutiny director or team will contact each provider in advance to schedule visits and to help them prepare. As a result of not being able to complete on-site visits immediately, KDADS will work with person-served staff, executive directors, and program managers on virtual platform options to help assess settings for final rule compliance. These options might include, but are not limited to, virtual interviews, phone interviews, virtual tours, document submission, photo submission, surveys, etc. KDADS and the Community Connections team will ensure all are aware of any adjustments or updates to timelines as we move forward. Getting ready for a heightened scrutiny site visit. A member of the heightened scrutiny team will contact each provider that are a Category 1 or Category 2 setting to help them prepare for their assessment. KDADS will be seeking a division of administration activities such as the budget, board of directors, committees, councils, staff, etc. Staff training, a clear distinction between HCBS and institutional activities in policies, procedures, and practices. The provider should be able to show how rights, choice, dignity, and respect are given to and shown to persons served. Restrictions are okay as long as proper protocols are followed. For example, person-centered documentation. KDADS will require access to persons served with HCBS and staff or volunteers for interviews. For Category 3 reviews, KDADS will be seeking policies, procedures, and practices for how individuals have access to the broader community. The provider should be able to show how rights, choice, dignity, and respect are given to and shown to persons served. There can be restrictions as long as proper protocols are followed, which are the person-centered documentation. KDADS may require access to persons served with HCBS and staff or volunteers for interviews as necessary for Category 3 reviews. After KDADS review of a heightened scrutiny setting, the goal is to show CMS how your setting overcomes the presumption of institutionalization. It is possible the setting will need a detailed plan to show how it can overcome characteristics of an institution after an on-site visit or its equivalent. If a plan is needed, it must be submitted to the Heightened Scrutiny tab for Categories 1 and 2 and to the Remediation tab for Category 3 settings. After the plan submission, the Heightened Scrutiny Director and/or Remediation Director will review for compliance and notify the provider by email using the Community Connections database. An evidence packet on how heightened scrutiny is or will be overcome for each setting will be published for public comment. The public comment process will include the evidence packets that are completed by KDADS will be posted for 30-day public comment period. Packets will be posted on links at Community Connections and KDADS CSP websites. All settings in which the state believes can overcome heightened scrutiny will be submitted to CMS. CMS will make the final determination if a setting can or cannot overcome heightened scrutiny. After the public comment period, all heightened scrutiny packets will be submitted to CMS with the public comments included. For those settings that can overcome heightened scrutiny characteristics, they will move into the ongoing monitoring process by KDADS. Settings that are unable or unwilling to overcome heightened scrutiny characteristics must transition HCBS participants to a compliant setting before March 17, 2023, or secure other sources of funding if a person chooses to continue services at the setting. The current timeline after the provider self-assessment closed in Kansas on February 29, 2020, the desk review, remediation, and heightened scrutiny process has begun. By July 1st, 2021, all settings remediation evidence must be submitted to communityconnectionsks.org. Heightened scrutiny category 3 settings can be removed from the heightened scrutiny category and not require submission to CMS if remediation steps are completed or implemented prior to July 1st, 2021. March 17th, 2023, all settings must be in compliance with the final rule to continue being paid for HCBS services. There are some possible timeline changes in relation to COVID-19, and KDADS will continually update on any timeline changes that occur through CMS. As we move forward with the heightened scrutiny process, you can expect additional guidance and trainings to help with the process in general. If you have any questions in regards to any part of the process for the settings final rule, please go to the communityconnectionsks.org website and utilize the many different methods for communication. This will allow tracking and also allow it to be escalated to appropriate staff to answer any particular questions. Thank you all for your participation, and we look forward to working with you to comply with the final settings rule requirements.